Today's webinar is Closing Streets to Create Space for Walking and Biking During the COVID-19 Pandemic. We hope you and your families are well and safe during this unprecedented and chaotic time that we're all currently living through. With many people working from home, we know that there may be the possibility for more internet connection and technical glitches than normal. So we are planning to have 3 of our 4 speakers on video today and 1 on audio, and we will default to audio only if necessary, if there's any internet or connection problems. We'll save time for questions towards the end of today's presentation, and if you have any questions about resources or other content you'll hear about today, please type that in to the chat box on the right-hand side of the screen at any time, and our staff, our fabulous staff on the back end, will be monitoring that and responding. If you have specific, more detailed technical assistance questions about Trails, you can email us via the link on your screen, and we'll get back to you as soon as possible. Finally, after today's webinar, you will receive a follow-up email containing a survey asking you to rate the performance of today's webinar and a link to our trail use and management survey in response to COVID-19. If you manage trails directly, we'd really like to hear from you and have you fill out that survey. And you'll also be able to find out more information about RTC's Trail Expert Network and a link to sign up for occasional updates from us. And most importantly, you'll also get a link to today's webinar. So first, we want to understand who is in the audience today. So we're going to put up a poll momentarily, and we'd love to know what sector you represent. So if you'd go ahead and respond to the poll, let us know if you're with a public agency, a nonprofit, a private organization, or an all-volunteer organization. So go ahead, and this will help us understand our audience today. Great, so looks like 42% of you are with a public agency, 38% are with a nonprofit, 12% are private, and 7% volunteer only. So got a lot of public agency folks and a fair amount of nonprofit folks as well. Thank you. And so just once again, a friendly reminder, if you do directly manage trails, please follow this link that you see on the screen, rails-to-trails.org/COVID survey. We'd really love to hear from you. There's a variety of questions to help us understand what specific challenges you're facing right now with managing your trails and what actions you're taking and kind of how you think you'll have to change your management tactics as time goes on during the pandemic. So onward to today's topic. As I said, my name is Liz Thorstensen. I'm with Rails-to-Trails, and I'm going to dive into our topic today. So during this time of extreme social distancing, we know that more than 261 Americans are under shelter-in-place orders right now, coming from state and local governments. These orders consistently indicate that outdoor exercise is allowable and essential, and many public health experts are reinforcing the importance of being physically active for our physical and mental health. RTC recently did an analysis of 31 trail counters across the country for the week of March 16th through the 22nd and found a nationwide trail usage increase of nearly 200% from that same week compared to last year. However, we know many communities don't have outdoor facilities equipped to handle this kind of surge, especially as trails and parks have to close in some instances to limit access. Also, for example, typical sidewalks, especially those in denser communities, are often not wide enough to allow for 6 feet of social distancing, and some communities don't have sidewalks at all. Many cities already practice open streets, ciclovías, car-free streets, and other traffic calming measures on major thoroughfares as standard practice both seasonally as well as on weekends. But with the unprecedented changes we're facing in the wake of the pandemic, converting more streets to open streets and other traffic calming measures for social distancing zones beyond just weekend days could profoundly change the quality of life for millions of Americans, by essentially creating a trail in every neighborhood. What started out as a situation that many thought would last only a few weeks now is projected to last many months. As the pandemic goes on into the warmer months, having safe space for people to safely walk and bike outside while staying close to home will be absolutely critical. RTC has put together a national petition, and we'll show you this link at the end of today's presentation, that has gone out to a large body of national audiences, and we're working with lots of different partners, and we've already had nearly 5,000 people sign on to the petition calling for more access to open streets all over America. So we'd encourage you, if you haven't signed on already, to do that and use that as a resource to connect with others in your community as well as your local elected officials. So with all of this being said, I am so thrilled that we have a really, really excellent lineup of speakers today, and they represent a diversity of geographies and a diversity of approaches to open streets during this time. We have 2 speakers representing city-led efforts, and we have 2 speakers representing advocacy-led efforts. So I think you'll learn a lot from them. So what we're going to do is I'm going to introduce each of them, and they're going to give the lay of the land of what their community is like, and what measures they've put into place, and kind of what's on their mind, what they've been learning. And so we'll go through all 4 of them, and then I'll ask them some questions, and then we'll have time for audience questions. So first up, we've got Jim Philby-Williams, Director of Public Administration from the city of Duluth, Minnesota, and Jim's on the line. Jim is the Director of Public Administration there, where he oversees library services, parks and recreation, maintenance, the city clerk's office, human resources, and the information technology operations of the city. So I'm so happy to have Jim here because he represents a medium-sized city of nearly 100,000 people in the upper Midwest of Minnesota. And so Jim, I'd love for you to share with us over telephone today. Tell us about your efforts there and what you've been learning.
Yes, thank you for the opportunity to participate today. Duluth is a city of 86,000 people in far northern Minnesota. We are snow country. The ground is still largely snow covered. And though my children have shoveled out the basketball court to shoot hoops, there's still some diehard skiers and snowmobilers finding a way to recreate. Duluth has negligible prior experience with closing streets to create more space for walkers and bikers, at least in the summertime. However, we are famous for our extensive system of natural surface trails and the importance of those trails to community life. In a normal year, April is infamously bad in Duluth for bike ped travel enthusiasts because most of our trails are inaccessible, either because they're prohibitively muddy as the snow melts, or they remain snow covered. Layer on the pandemic and the vastly increased need and desire of our citizens to be active outdoors, concentrating them in April on a shrunken set of bike ped destinations, and we quickly saw unsafe concentrations of people. We got together with our leadership team, police and fire and public works, and came up with quickly 3 different options for providing a variety of appealing, close to home, neighborhood-based bike ped destinations that are designed to enable people to be active outdoors without increasing disease transmission risk. On your screen, you see a parkway, a road through a park that is partially closed in the winter for snowmobiles. We expanded that closure by a mile and plowed the snow to open that up for bike ped use. Next slide, please. We similarly closed a park road in a urban park at the core of a dense, low-income neighborhood. And finally, we got permission from our state partners to go out on the state's snowmobile trails and begin to plow some of those. The results thus far have been very positive. There are people heavily using these new opportunities, but they're clearly insufficient. We're still seeing unsafe concentrations of users on our most popular trails, and so we're now developing another phase of roads that we hope to dedicate temporarily to bike ped use in the next couple of days.
Thanks, Jim. You want to tell us, before you end, tell us a little bit about the photo we're seeing and the graphic we're seeing as well?
Sure. We're trying to give folks some concrete sense of what it means to say 6 feet away. And with the help of the National Recreation and Parks Association, we put together this graphic. And the photo is from the first day that we were open. We're probably seeing double that use at a typical moment now. So enough to be well worthwhile, but still consistent with social distancing requirements.
Wonderful. Thank you so much, Jim. We appreciate it. So next, we're going to hear from Sarah Clark-Stewart. Sarah's the Executive Director of the Bicycle Coalition of Greater Philadelphia, a membership-based advocacy and education nonprofit organization where she has been on the staff since 2010. And also have to say, Sarah is a really great partner of Rails-to-Trails. We work together closely on the circuit trails in the Greater Philadelphia region. So welcome, Sarah. Tell us about Philadelphia and your efforts there and what you've been learning.
So thank you, Liz, for inviting me to participate in this webinar. I'm very excited to be here and to tell our story. So for those of you who don't know, Philadelphia is the 5th largest city in the United States, and we are part of a region. We have 8 counties surrounding Philadelphia, and we are the 6th largest region in the country. The city itself has about 250, just to set some context, has about 250 lanes of bike lane, sort of miles of bike lanes. And we have, the whole region has about 330 miles of off-road trails that are part of the Circuit Trails network, which is planned to be as large as over 800 miles. And so we have a fair amount of, of off-road trail space scattered throughout the 9 counties. And the city itself does have some experience with closing streets. Back in 2016, we had the Pope visit, which was a real incredible shock to the city in that every car had to be cleared out of Center City. That's our downtown core. So that really kind of whetted everyone's appetite for having a closed street program. We hadn't had one up to then. And so our current mayor, Jim Kenney, instituted a program of closing 1 street, but it's only 1 day a week during the summer, during August. And the other experience that the city itself has is it has during our April to October summer period, it closes one of our river drives that I'm going to speak about in a minute, sort of partially closes it over the weekends. So we have, so that's sort of the context. Now, the trails are very, very popular in Philadelphia and throughout the region. And when the pandemic hit us and people were encouraged to go out, there was a lot of demand for those trails. And the previous picture gives you sort of a sense a little bit of the overcrowding that we were experiencing. It's hard to do it justice to take a good picture of it, but it was easy to actually, if you can actually go forward, I'm sorry, if you could go forward 1 slide. It was easy to get documentation of how overcrowded it was. And we were fortunate to have around 15 different trail counters throughout the Circuit Trail network. And my staff were able to get that data and do a similar analysis that Liz described that they did it nationally, and found that over the same 3-week period from last year to this year, that most of the trails were experiencing over 100% increase. And in particular, Kelly Drive, which is where our famous Boathouse Row is, was experiencing a quadrupling. And if you can go backwards one slide, if that's possible. That meant that all these folks were being concentrated on the lower right red arrow on a trail there, and it was impossible really to keep that safe distance. And so where you see the second red arrow, which is Martin Luther King Drive, it became crystal clear almost immediately that if that could be closed, we could alleviate the pressure on the path that's on Kelly Drive. And so, and given that we knew that this was a road that the city had experience with closing, it seemed like a fairly straightforward ask. And we also knew that the quadrupling that happened on Kelly Drive was during a fairly cold period. We've had a lot of rain in the last 3 weeks. It's been in the 50 degrees, and it's just going to get even more stressed when the weather warms up. So what we did was as soon as we had that information, that data, we put up a petition, and I believe that was on Thursday the 20th, and it got over 1,000 signatures. It got 500, I think, just within a few hours. And on Friday afternoon, the mayor decided to close the drive to cars, to open it up for bicyclists and pedestrians, and make that a 24/7 closure. So it was much better than a weekend closure, and it came with a huge amount of support and excitement from across the city, and gained a lot of attention. So it was very big. Everyone was really happy and pleased that this could be done so quickly, and we were very excited to have been able to help make that happen. I put this picture in because I wanted you to see that one reason this was fairly straightforward is that this particular Martin Luther King Drive already has these gates that can be open and closed, and that was one big contributing factor to the fact that why the mayor was able to do it so quickly is because they know how to do it, and they have the means to do it with very few resources. So it was fairly straightforward to get to a yes. So in terms of what we've learned is that, and this is what it looks like now with the skyline that was taken yesterday, and this was on a cold, windy day in the afternoon. And I think that again, as I mentioned, as soon as it warms up, it's gonna really increase. So we've learned a lot from this. What we've learned is that this is great, but we need more. We think there's more parts of the city that need access to this kind of space, and we want to try to work with the city to make that possible. In full recognition of the stress that the city is under. We have 8,000 acres of parks, of which most of it is off limits, so being encouraged not to go to playgrounds and basketball courts. But there are roads in those parks that could also be closed. And we are trying to we've been working with community groups and city council to find support for a series of a set of other streets and roads that could possibly be closed. We want to be presenting that to the city as soon as possible. So that's a work in progress that we, have in place and are ongoing, because we do recognize that this pandemic will be with us for a few more months. That's it.
Thank you so much, Sarah. That was great. So next, we're going to turn to Jody Medeiros, Executive Director of Walk San Francisco. Jody is responsible for leading Walk San Francisco's strategic work. She has a long and successful history leading communications, fundraising, and advocacy at urban livability, active transportation, and poverty alleviation nonprofits. So welcome, Jody, and I'm so excited to have you here to tell us about your past Open Streets effort and the campaign that you recently underwent in the wake of the pandemic. So tell us a little bit more.
Thank you, Liz, and thank you to Rails-to-Trails. It's really exciting to be on this really esteemed panel. So Walk San Francisco, we have been around since 1998, so over 20 years, and we are the only pedestrian advocacy organization focused on people walking in San Francisco. Our big city goal is really Vision Zero. We're trying to end all severe and fatal crashes by 2024. And Walk San Francisco really does believe that San Francisco can and should be the most pedestrian-friendly city in the nation. So we are in a very urban environment, just like all of you, and millions of people already walk in San Francisco. We counted that we have about 884,000 residents with about 265,000 weekday commuters and almost 25 million annual visitors each year. And we know that our city has about 22% mode share for walking, which is also the same number that we have for people using public transportation. We've seen a drop in this in the last couple of years with the uptick of the Lyft and Uber rideshare. Next slide, please. So why do we do this work? It's because pedestrians are the ones that are suffering the most from traffic violence in San Francisco. We had 18 pedestrian fatalities last year, and it was one of our worst years since we adopted Vision Zero in 2024. Next slide. In addition to our fatalities, we know that it's also people walking who suffer the most from severe and critical injuries. And so this is our combined data with not only our police reports, but also we do data with the SF General Hospital. And so this is why we do our work. Next slide. Why, Walk San Francisco does believe that we have so many people walking in the city that we have this great opportunity to use all the tools in our toolbox to really get to safe spaces. We've had some success. We do have Sunday Streets, which happens 6 months of the year. First Sunday, one Sunday a month. It goes to different neighborhoods. We did get this practice from Bogota, Colombia. And we've been doing this for over 10 years. But we needed something that was more regular and everyday. So for the last 10 years, I did want to quickly share a success story that we had in just earlier this year. And this is our Market Street. Our Market Street is our main street. It's our biggest, most used thoroughfare. As you can see, 75,000 weekday bus riders, 90 buses an hour, 500,000 people who walk down the street every day, but yet we know that 5 out of 10 of our most dangerous intersections is also on this street. So this is why Walk San Francisco has been really busy in putting our back into this campaign. And after over 10 years, we did win the approval of Market Street to become what we call our Better Market Street Plan. It's funny that this was started as a pavement project about 10 years ago. It's been a huge collaborative between multiple nonprofit organizations, Walk San Francisco Bicycle Coalition, and what it really did take was a ton of political will to make this happen. What really the start of this project was the removal of private vehicles on Market Street. So this also does include the Lyft and the Ubers. And what we really saw was that this is something that we could celebrate. We're not going to see the results of this because of the pandemic, but in the first 5 weeks, we did see bus ridership increase, bike ridership increase, and we're waiting to see the results once traffic patterns are back to normal and people are back to their routines, what kind of improvements we're going to see on the crashes between pedestrians and turning vehicles. So that's a success that I think that we are very proud of. And now I want to talk about the campaign that we most recently did that was in response to our pandemic. And this is trying to get our JFK Drive in Golden Gate Park car-free. So our park is celebrating 150 years. Our April 4th celebration had to be canceled because of the pandemic, but the park is one of these gems in our city. It's, as you can see, we've had car-free space for more than 40 years. And we've also had car-free space on Saturdays for more than 10 years. So this is not something new to our city. This park has had cars restricted in the park. And so we really wanted to capitalize on this possibility and see what we could do for and during the pandemic. So next slide, please. On March 18th, when we were already in the heart of the shelter in place, Walk San Francisco launched an online campaign to make JFK Drive car free and increase our space for people. We were in deep contact with the San Francisco Mayor's Office, Mayor London Breed, and our partners at the Bike Coalition. We're talking to all the general players. We're talking to Rec and Park and Director of Transportation, and we had buy-in from those other agencies. We had great confidence that this was going to go forward, and it was pretty miraculous. Just like Philadelphia, we had 500 signatures in the first 24 hours and 1,400 signatures to say, yes, let's make this a car-free space every day during the pandemic. And we really did have everybody's ear. What ended up happening was that the mayor's office said that leading the pandemic was our Department of Public Health, and they had the final say. And so unfortunately, on March 25th, we had to, in a press conference, our head of public health specifically talked about JFK and said that he was not going to let this go through. This was emphatic, it was clear. He thought that it was going to do much more harm than good. He thought that it was going to encourage congregation in the park and not the social distancing that we really firmly believe needs to happen during this pandemic. And this put us in a really tough spot as a nonprofit organization and as an advocacy group. And this was something that, we've talked to all of the players, and we had to, we backed down. We basically ended up saying that while we thought that this was a really good idea, we think that opening our streets for people in a time when we really need to have more space, but we also feel that this was not the time to be pushing our Department of Public Health when they were really focused on flattening the curve and keeping people safe and making sure that we all had our safe distances. They are still encouraging people to go out and walk and bike, which is great. We still have that. They have closed all of our playgrounds. They've closed our parking lots to things like the beaches. And they are really threatening to close our parks if they see people congregating. So in his eyes, it would be really irresponsible for our Department of Public Health to close streets and encourage people to go to our parks. So of course, we are deeply disappointed, but we also believe that we are in this for the long haul. Car-free JFK is a campaign that is ongoing. It's something that we really think that we could get after this pandemic, that we have more relationships to build, we have more to do. And so what we have done in showing our allegiance and our understanding of what's really important is we've pivoted and we've really started creating these messages of how you can do activities in your neighborhood. We've put up other different blogs regarding what you can do with your children. on walks and keeping that active, but staying to your neighborhood. And the other thing that we're really keeping in mind is Golden Gate Park is in one part of our city. Once we start focusing on what we can do in your neighborhood, that makes it a very equitable approach to how people can still get out, get healthy, get some fresh air. I mean, it's the cleanest air we've had in San Francisco for decades. And it really does allow people to get the mental health and the physical health space that they really need, and to hopefully keep the 6-foot distance. So that is our latest campaign, and we will still stay busy and trying to push for more car-free streets in San Francisco.
Thank you so much, Jody. That was great, and I know we'll dig in a little bit more in the Q&A section. So thank you so much. So now we're going to shift over to our next speaker, Laura Leticia Bajomon Peña, and she is the bicycle manager in the Ministry of Transportation in the city of Bogota in Colombia. And Laura joined the Department of Mobility with a focus on 2 priority issues: the safety of cyclists and increasing the participation of women in cycling. She affirms that while Bogota has gained momentum in the use and promotion of bicycling, it remains necessary to increase the overall status of the cyclist, making their routes safer, more comfortable, and a dignified experience, which also will enable more women to choose traveling by bicycle. And before I hand it over to Laura, I just want to say that while we have a mostly American audience today, I think it's so wonderful to hear from Bogota's experience. I think they have the most deep experience in this area. They really started the global open streets movement by starting their ciclovías in the early 1970s, and that really started the global wave of other open street movements all over our country and certainly all over the world. And having had the privilege to travel down there this past fall and see their amazing facilities, especially for bicyclists in particular, is just amazing what they have accomplished. So I'm so happy that Laura was able to join us. And I think that we'll all be so inspired about what's happening in Bogota and how we can, take that into our American context and be inspired to really do a lot with that. So with that, Laura, I'll hand it over to you.
Thank you very much. I found the presentations of Jody, Sarah, and Jim very, very, very interesting. I want to start with an overview about what already Liz said. Bogota is the birthplace of ciclovia. We have 124 kilometers of main avenues shut for pedestrians that happened every Sunday and during holidays, and also a car-free day we have every year. Since 5 years ago, we implemented also ciclovia. We have also a very bright network of permanent bike lanes, 550 kilometers, and it supports almost 900,000 daily trips on bikes. That's the third way of transport before public transport and of course walking. And there is a lot of bikes in our homes. Please go on. Next. Thank you. So what we done since March 16 was facilitate and promote an individual transport alternative for those that still have to go outside. Of course, the message is to stay at home, but health workers, the people that are private guards, working food supply, cleaning staff. All these people have to go outside, and public transport is not that safe. So giving dedicated lanes, bike lanes, is we think a very good alternative, affordable, convenient, also economical. So um, we start before the lockdown. We made first of all an alert, then lockdown drill, and then an actual lockdown. And what we done was first of all an interinstitutional coordination between the sport and recreation office, mobility office, transport company, and of course the police department and risk and emergency office. They help us. We implement a lot of kilometers. I will show you how we done. Um, but we try to do corridors as a mirror of the most crowded public transport route, and that's key because we already have our network, but not all the corridors are in their strategic place, or are not that bright. And we prioritize the traffic lights for cyclists, and also a lot of signaling regulations, and with a lot of people on the road at the first moment. Now less people. I think the success of what we've done and support on the capabilities that we already had. The sport and recreation office put all the logistic, and the mobility office put all the technical evaluation. Um, Also, the community respond very well because they already know how it works every Sunday and the car-free day. So they use the dedicated lanes and adapt very quickly. Also, we adapt, modify, remove, or add corridors according to the conditions. Next, please. So that's the map of Bogota. The green lines are the permanent cycling infrastructure. We implement these temporary bike lanes in 4 phases. The first phase was, thank you. The first phase was 22 kilometers. So we work the whole Sunday online to plan these routes. Then we try to connect the west part of the city with the east side part, where the people live, with where the people work. Next, please. The second phase is 117 kilometers. This is the ciclovia of car-free day, but we had a big impact in public transport. The speed was very low in comparison with a normal day, so we decide put it off, remove all the signals. Next, please. Remove the traffic cones and some sections that connect with this corridor. That's how we build the third phase with 76 kilometers, and we maintain this phase until March 19. Then we have the lockdown drill, and in this moment, in these 4 days between March 20 and March 24, we analyze how the cyclists move in Bogota, and we recognize that in this situation we need some connections and the permanent bike lane network and some points at the bridges. Next, please. So this is the data of how the people move through the city. A normal day is the blue bar, and how you see in this moment in this week when we don't have any restriction, the bike use increase. Next one, please. Then this is the data of the last week. A normal day is the green bar, and some places we see that there is not that much cyclists, but it maintains in the corridors, and in some other places like the south part of the city, bike use increase every day. Next one, please. And in transport and public transport, we have Transmilenio. In a normal day, we have almost 500,000 trips. And this week, when we implemented this measure, it decreased almost 43%. Then the next week in the lockdown drill, the reduction was 80%. And last week we had almost 30% of the trips that normally we have. Next, please. Next, that's the behavior of also the bus routes in different neighborhoods. So the blue line is the normal behavior. The green line is when we finish the lockdown drill, and yellow and red are the how it is stabilized the demand of public transport in these days. Next, please. Mm. We had a lot of people outside the first week, almost 150 people. Uh, those with the green jackets, blue jackets are from mobility office, the other one from sport mobility. And like you see, we just took a lane of the whole road to expand the space for cyclists. Next, please. Now we have some challenge like the diff of traffic signals, because we put it the last Monday and we let it 24/7. So some of these elements were took away. We have also invasion of bicycle lanes with especially cyclists, and also the increase of speed that already told Jody and Sarah. So we make campaigns to make the people conscious. Next, please. Next, please. So we make a survive of the perception. I have to say that mostly of the people that answered the survey already use the bike, but we can see that motorcycle, Transmilenio, uh, and a private car decrease, and 6% of the people decide stay at home, and the other 6% go to the bike. Next, please. But the most of the people think it was a very good measure. So I think the people is think we are doing something in these moments that we have. So we don't know what will happen. So thank you.
Thank you so much, Laura. It's fascinating for us to learn about everything you're doing there. RTC has prepared some questions we have for the panelists, and then so we'll go through those for a few minutes, and then we'll move on to your audience questions. So you still have time. If you're in the audience and you want to type in your questions, we're currently collecting those. So keep typing those in, and we'll be monitoring those. So a question for really for all of you on the panel. You all talked about a diversity of approaches of past experience that you're part of, whether it's traffic calming work to allow for temporary bicycle lanes, or ciclovías, or open streets, or Jim, the seasonal road closures for the snow season. So I'd like to hear from all of you, how do you think that that past culture that either your agency or your city had of already having experience with these kinds of measures, how do you think that really enabled you to move forward in your conversations about taking action during the pandemic? Maybe we'll start. Sarah, can I pick on you and have you start first?
I think I mean, Jody essentially has alluded to the same thing. I think the comfort level of the different agencies was really key. And so I think for us, the comfort level was high because the closure was something that the city had a lot of experience with. I think many people also recognized the overcrowded nature of the trail on the other side of the river. Everyone was seeing it. It was extreme, and so I think that shared experience sort of led to a fairly quick decision. We were, I mean, in the sense that Philadelphia was just, we didn't have the same kind of, I don't know, I don't really, I can't go into sort of exactly why our public health commissioner didn't weigh in like San Francisco's did, but that's what happened, apparently. But I think the having agencies being able to have sort of muscles exercised is really important. But the reason I sort of brought up our experience with the Pope is that I think what we're going through is when you have these sort of big, big events like the Pope coming and clearing out every car for a huge area, or the pandemic where your traffic is dropped by like a half or more. It does cause a big kind of shift in people's thinking about all this space that that cities and towns have that is largely used by only one mode. And so it's we hope we can kind of continue to have that kind of bigger conversation to have more flexibility with the space than we have now.
That's great, thank you. Jim, do you want to chime in and tell us, what do you think enabled Duluth to act so quickly?
I think we have a leadership team led by our mayor that has a sophisticated appreciation that supporting Duluth through this crisis goes beyond simply depressing disease transmission rates and goes to supporting the broad emotional and physical health of the community through what is a collective trauma. I think also our leadership team is very tight-knit, brought together by the experience of working through 5 declared natural disasters in the last 8 years. And so we're accustomed to working across departmental boundaries, and making speedy, wise, decisive choices on an expedited basis. So that's been a great help as well. Generally, this has been a pragmatic, public health-driven, emergent decision made as an integrated part of our emergency response, not as a tangent or distraction from it. And so, on the tail end of this, we're going to be interested to harvest any lessons learned there may be about alternative transportation. But our presence focus really is on simply getting our community through this crisis well, physically and emotionally.
That's wonderful. Thanks, Jim. Laura, what are your thoughts?
Well, actually, for us was a key element that we already had the organization, the logistic, all the contracts, and what we done was taking these elements and put it all together under consideration of the mayor, and she said, let's go on. And so this strong leadership, and she's very convinced of bike use as a power element and a very good tool for climate change and a new perspective of the society. So it was, I think, a very good decision making chain. And then when we had articulated the management, then we can take decisions very quickly and put the people together to work. And also the data that we collected, because maybe someone have some doubts about what we done, but with this measure, the monitoring that we done, we can say, okay, we make this decision, maybe it wasn't very good, but we corrected, and now we implement or modified something.
That's wonderful. Thank you so much. And Jody, do you want to add anything?
Just that, I think the biggest lesson for us for this was that our relationship with our head of Department of Public Health is not as strong as it possibly could be. And while we got buy-in from other people within the agencies that thought that this is a good idea and that we have the ability to do this and turn it around quickly, because it wouldn't be something new, it's something that we do on Sundays, it is something that we do on Saturdays. It was our city's leadership that was looking to our head of Department of Public Health for the final word. So us not having that direct line to him, but other people in the department, it wasn't enough to really get him to do what we felt we needed to do. He's also, his experience and his expertise was the AIDS epidemic, and so he has experience in trying to already, curb rapidly spreading disease and viruses. And so therefore, I think that our mayor is leaning on him to do this. And I wish we all had crystal balls to know like which method is going to be the best thing to use. Is it not giving people place to congregate, but giving people more space on our streets? Or is it just taking that all away and seeing how it goes? I think what people are really worried about is, as our city has closed the parking lots to the beaches and things like that, where people used to bring their dogs, they are now driving to Golden Gate Park to have that additional space. And so it's attracting more people into the park. And I think that we all fear that even Golden Gate Park is going to eventually be closed to all people. And so it's one of these things where, yeah, you have to try to decide where do you push to get the most that we possibly can get at this time.
Great, thank you so much. Question for you, Laura. You mentioned being able to rapidly pilot different approaches. And so what the city's ability to try different things very quickly. What do you think you learned most from being able to try those things and then switch gears quickly?
I think we learn a lot about how fast can the behavior of different transport modes adapt, especially bike, pedestrians, and buses. When it is planned, we can complement together because car use sometimes uh, it's hard to move it. So when we don't have cars, we can move the people more efficient. Uh, and I think it is also the culture of the people that the people in Bogota adapt very quickly because most of them doesn't think or doesn't have something secure in a month or 3 months or maybe next year. Mostly of the people doesn't know what will happen. So we are very resilient. So we make a resilient temporary infrastructure.
Excellent, thank you. Question for Sarah and Jody. It seems like this is going to probably be going on for quite a while. And so, it might be safe to say that there's going to need to be, more open streets, more access to this space. So when you're seeing kind of the situation we're in and the long-term implications of the situation we're in, that it could go on for many months, how what are you thinking when you're hearing city leaders say, we're dealing in triage right now, we don't have time, we can either give you nothing or we can implement this one piece but nothing else. But knowing what you see coming, kind of how do you continue to or do you continue to advocate under that environment when they're kind of telling you we're busy over here, but you see this really important need that's going to keep bubbling up over the next several months?
Well, I think just continue to be persistent and ask for an open dialogue and not and if the answer is no, then okay, well, return and come back and ask again. I mean, I think that the thing to we just right now we're talking to community organizations and our city council leaders to gauge their their input and their opinion about opening up a few more streets or roads, park roads, so that the opportunity is spread throughout more of the city, so it's more equitable. And then try to start with a conversation with our city leaders. I mean, we're in the middle of the probably the worst part of the pandemic right now, and so we're just trying to take it one step at a time and work with the conditions that we have in front of us. So I think just keeping keeping lines of communication open and try to present various options that we think can help the city's residents all throughout the city and support their physical and mental health.
Excellent.
Yeah,
Excellent. Thank you.
For us, this is JFK is definitely a long haul campaign. As I explained in my original, Market Street was a 10-year campaign. JFK for getting car-free space for 7 days a week has already been a campaign of ours and our partners at the San Francisco Bicycle Coalition. So this is something that we are just keeping the lines of communication open. We're trying to get those promises now, that this is going to be something that we can have for the long future, and maybe chip away at what we can get from post-pandemic. It's something that, working with the supervisors or our city council members that are adjacent to the park, making sure that they're also on board and they see the need for this. They're seeing it on a daily basis in terms of how many people are using the space and what that space could look like for people. So really just trying to keep the communications open, doing the back end conversations now for what could lead to larger wins in the future. We have to, we're in the thick of the pandemic currently, but we also have to believe that we're going to get to the other side of this, and that people are, we want the long-term impacts to be positive after the shelter in place is over.
Excellent, thank you. So Sarah did a good job of, just alluding to the question I want to ask next, which is, for some of you and many other places in the U.S., the initial measures that have been able to take place are, tend to be concentrated in like one spot or one road or maybe two. So maybe we'll start with Jim for this question, because I know you're thinking about this, Jim. How are you thinking? Do you think that more widespread, access to open streets needs to be, considered and implemented right now? And kind of how are you thinking through that? If you do agree, there does need to be more right now.
Sure. I think we're looking at a map of the city and first identifying all of the neighborhood-based bike pedestrian paths that are already in place that people can opt to use rather than going to our big waterfront destination trails. And then after we've done that, there's clearly some holes in our geography where the existing trail system does not suffice. And we're really trying to drill down in those areas and look at roads to fill that gap. And I think there'll probably be multiple phases of this. We rolled out the first phase, worked well. We're going to roll out a second phase. This isn't a time where anyone can support a lot of time-intensive process. And so decisiveness, supported by the streamlined public process that comes with state, federal, and local emergency orders, is a necessity.
Thanks, Jim. Anyone else on the panel wanted to chime in terms of, the need for having more open streets available outside of just one or two locations?
Well, I think we definitely believe that that's a goal that we would like the city to work towards, to ensure that enough space is available equitably throughout the neighborhoods. But that's and I think Jim put it the right way. This is about phasing things in, I think.
I agree. Oh, go ahead, please.
Oh, sorry. I just wanted to add, and for San Francisco, again, this is beyond just the COVID-19. We were very fortunate in that our board president for our Department of Transportation, they basically, after we won Market Street, they asked the city agency to come up with a list of other potential streets for car-free space. And so we found that to be a huge win, because it is the people that are realizing that car-free space are necessary, not only for what we see as Vision Zero, but also for the health and well-being of the city as a whole and its residents. And so it's just one of these things where we are looking at where the next possible space is, and that should be in all neighborhoods across the city. It doesn't matter make it a lot more equitable that way. And that is also why we're trying to encourage people in every neighborhood to find more recreational space in their neighborhood and use that as a way during the pandemic.
Great, thank you. We've had several questions come in about how do we prevent overcrowding on open streets. I think a concern is, in the same way that trails became crowded during this time, will open streets become crowded? Do they become too popular? And does that put them, also at risk of being closed down in the same way parks and some trails have been? Jim, you shared a signage example to educate about social distancing. So I'd love to hear from all of you, what are ideas about how can we be educating people about maintaining social distance while they're on open streets or temporary bike lanes? And, are there any methods of monitoring or enforcement that have been discussed? And, how can people work with local officials who might be, concerned about this kind of overcrowding? So maybe we'll start with Jim again, since since the signage was, referenced as part of this question.
Sure. I think our goal is not risk elimination; it's risk management. It would be impracticable and foolhardy to attempt to eliminate all risk by cooping everyone up. We've got countless people working in at-home offices with children running around their feet, bored and underoccupied. There's no wise path forward where we simply shut down access to the outdoors indiscriminately. So the question is, how do we minimize those risks? What are the places and activities where those risks are simply excessive, cannot be reduced enough? And what are the risks that we can live with?
Thanks. Anybody else want to chime in on this question?
We've basically been echoing the mayor's message as much as possible in terms of the 6-foot distance, and also kind of giving people a heads up that if we don't keep that social distance, we might lose this park space. So not that I want to increase fear in anything else, but again, trying to keep people in their neighborhood, focus on their neighborhood. And the mayor's message has been literally only for necessity should you be going outside. I definitely understand, Jim. I mean, families with children and trying to just, get people out as much as possible, especially since in San Francisco, the weather's been great. I mean, we have sunny mid-60s. It's like ideal. So we are just trying to encourage people to keep a safe distance, use your neighborhood as your recreation space.
And then the second part of the question, do any of you have some wisdom or advice to share for, people who are, working with local officials who are concerned about this? Kind of what's your advice? What's your advice to them?
This is Jim in Duluth. I think send city officials your ideas. We received an idea unsolicited yesterday from somebody who suggested a specific road to close and dedicate to bike ped, and it was a great idea, and our team has started developing and exploring it. And there's never been a time where we more needed good ideas from a diversity of sources. So share your ideas.
Great. Anybody else want to chime in on that one?
I guess I would just, yeah, I mean, I think Jim previously said it really well. It's going to be incredibly difficult to keep everyone inside 24/7. So, you can imagine doing that and I guess some cities around the world are trying that, but that's not a long-term strategy. And if there's only one spot in a big city that's available, then it's going to get overcrowded. So it's better to have, more spaces, more distributed, to help reduce that density, that overcrowding to one area. And I've never, we all of us, I think, have never been during a time when people are listening to their elected officials, and we've just got to, as Jody said, we have to keep echoing what they're saying, and um, and and be good stewards of the of to we're all in this to, the saying, we're all in this together, but we have to be listening. Everyone is listening. Everyone is scared, and and so if we can follow directions, we can then we'll be able to use it.
Such great points. Thank you, Sarah. I'm going to direct this next question to you, Laura. How do you recommend, or what is Bogota thinking about, as the pandemic, changes? Hopefully, once it starts to go down in intensity, how do you foresee the changes you've made changing as the pandemic changes, and over the long term, how do you make those changes, and what kind of data do you think the city will be looking to guide those decisions, since you showed such a rich access of data that the city uses?
Mm, I think one element is the ongoing plans that we had, because some of the corridors that we implemented are already in these plans, and we were looking about how we make it permanent. So we saw the opportunity to make a trail and identify how the people behave. Of course, it's different when you had the whole cars and the whole public transport there, but we think it is the opportunity to make it real. Uh, we we take this time to plan, to analyze, for example, how useful is for medical, for health workers, or doctors, or how we can use this for this moment and in the future. um, and also I think we we have to be more flexible a little bit with these laws and all the plans. Uh, so uh, I think the data is very, very good, but it's changing all the time, all the people, and so our big challenge is avoid that the people take motorcycle or cars as an individual transport system, so it will be a collapse.
Thank you. Question for anybody who wants to jump in. What role can the private sector play in supporting COVID-related open streets and other kinds of traffic calming and temporary bike lanes, things like that?
I guess it would help if they would call for it also, and be publicly supportive. It would help if they would sponsor it. That's, I mean, we're famous for being the poorest big city in the country, and so resources for us is incredibly important. So I mean, I think getting engaged in this kind of public civic dialogue would be really welcomed.
Excellent. Thank you.
If I can chime in, also, I think, supporting the advocates that are doing this work in many ways, and calling us and asking us how they can support, how their voices can be leveraged, I think is also a good way to help. Advocates are, we're the ones at the front lines. We're the ones that are really trying to make this happen and mobilize so many different groups of people. Encourage, like if we do put something out, asking, being, thoughtful about giving it also over to their employees who might also want to be participating in this and letting them know that this is happening, I think also is a huge help. And then to companies like Waze, Lyft, Uber, Google Maps, and things like that, if we do have any kind of car-free space or people where there are more people biking and such, to make sure that their apps are changed so that they're not directing their car traffic in that direction, but keeping those areas free and clear so that people can have those space.
Excellent point. Thank you both. Another question, what considerations should advocates take into account when approaching local government with proposals at this time? What kind of information would be most persuasive, especially in places that maybe don't have previous experience with open streets and this kind of temporary bike ped infrastructure?
I'm happy to jump in. For San Francisco, I think seeing is believing. And what we did to try to get folks to realize that we needed something like Bogota, we had to show them what really works and what the numbers are and why this is really good. So I think pointing to other similar size cities, to other cities that are doing this, to having even places that would be willing to have conversations with these other elected officials and what have you, in terms of maybe the why we were opposed to it and what happened in our city when it really happened. That is one recommendation I would have in terms of city peer-to-peer groups talking about what really impacted the change in that way. But I also, examples from other parts of the world, it's what we really use to drive home in terms of why we need this kind of open streets.
I mean, I think data helps a lot. If there's any possibility of doing counts safely, or if there's access to data from automated counters, I think that helps drive home especially if there are areas that are being very severely overcrowded.
Okay, great. Teeing up our next question here. So what do you think is the biggest obstacle to convincing those with the power to open up streets for pedestrians and bicyclists during this time?
Well, I think there's probably two, right? I think there's the fear that it has been mentioned before, the fear that people will not exhibit, will not practice safe physical distancing from each other, so that it could, in fact, exacerbate the problem rather than lessen it. And I think the other factor is cost. I think that there is for us at least, if closing a street requires police presence or barricades or jersey barriers, those are resources. And so it's the sort of the operations of it that I think probably factors into decisions about whether or not it's really possible to pull it off.
I agree. I couldn't have said it better. Thank you, Sarah.
Okay, so one more question, and it's some of the themes we've been hearing from people, but I'm going to say it in my own words. How do you see, with whatever you've been able to accomplish and implement, how do you see that being able to carry through and have more safe spaces for pedestrians and bicyclists make sure that your work endures after the pandemic wanes. So, once life goes back to normal, whenever that is, no one knows, but the successes that you've been advocating for right now or implementing right now, how do you think you can sustain that after we're out of this crisis period? Maybe we'll start with Jim again.
Well, I think the way to get the most traction on active transportation in this crisis is actually to entirely put aside the active transportation agenda and dedicate your organization's efforts and thinking wholly to the narrow, compelling problem of helping communities get through this. Public leaders are just swamped with emergency decisions right now. And as much as I share the active transportation agenda, if somebody called me and it was clear they were pushing an active transportation agenda, I would not have time for them right now. But if they called me with an idea to help us get through this that happened to have active transportation dimensions to it, I'm all ears. So I guess that's my 2 cents.
I love that. Laura, how do you see the changes you've been implementing now, impacting sustained change, after the pandemic goes away?
I think it's very useful to change the normal life of the people. Actually, we live now very different as 1 month before, and I think this change and this routine was broken, so we can build a new one. And this offer of spaces help to make this decision, because a lot of people in Bogota, for example, use the bike just on Sunday and doesn't use it to go to the work or to the university. They feel insecure, and we are working very hard not just to give the spaces, but also speaking with the police department and identifying these places that make the people feel insecure, and try to make it better, or uh, act if something happened. So I think we can use these very low numbers of people that go outside, and show them another face of the city. But we can make better, maybe in a couple of weeks, or when it depends on what happened next. But I think we should work on maintenance, on the light in the city, make it better, um, and identify the new expectations of the people.
Excellent. Sarah, Jody, any last words in regards to this question?
I wouldn't mind chiming in very quickly, and then Sarah, you can have the last word. For us, with 1,400 people signing on to our petition in just less than a week's time, I mean, this is more members than Walk San Francisco has. This has shown that there is a deep want and need for car-free space. So it's really up to us now as an advocacy group to harness that energy, raise those voices, continue to communicate with those folks. Only 46% were people from the surrounding park area. So that means there's more than 50% from other areas of the city. And so this is a great opportunity for us as an advocacy organization to really listen to the people, see what they want, and really figure out where we can bring car-free space to other parts of San Francisco and win JFK car-free 7 days a week.
Thanks. And final word from you, Sarah, before we wrap up.
That's a lot of pressure. I just think, I think that this is, we're going to have to just keep having these kinds of so even if they're difficult, they're great conversations about expanding car-free streets, whether it's in our parks or you know, maybe hopefully expanding our Philly Open Streets program. And I think, you know, make the point that there's a lot of appetite for this. There's a lot of desire, a lot of demand, and it can be done during an emergency, but it can also be done, you know, better not during an emergency. So that's what I'm hoping we can, you know, in a sense, just continue to have to sort of broaden out the use of streets for people as much as possible going forward.
Wonderful. Thank you so much. Thanks to all four of you. You did such a great job. I learned so much. And thanks to our attendees as well. And I just am so glad that we had such wonderful representation from not only across our country, but internationally in Bogota as well. So I think there was so many great lessons that you all shared that can be applied to so many different kinds of communities. So I know that that you're going to make an impact by sharing your thoughts today. So thank you for so much. So just a reminder that today's webinar was recorded and we'll be making it available to all of you as well as on our website. We'd love to hear from you and hear your thoughts about our webinar and what we can improve in the future. We are also going to continue to provide rapid content in real time in response to this pandemic. So we want to hear your ideas, what kinds of topics would be helpful to you. And then just a friendly reminder, we have built a really wonderful resource page specifically in response to the pandemic with all kinds of great resources on it. So we really encourage you to go there, and we'll be adding to it all the time. So thank you all so much for joining us today, and you'll be hearing from us via email as a follow-up to today. So thank you all. Take care.
Thanks.
Thank you.
Bye.